Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over diabetes mellitus. This is part of a NCLEX review series on diabetes, and what I want to be doing in this video is I'm going to be hitting the pathophysiology in diabetes, the complications, the different types, and the nursing assessment. In the next video, I'm going to be going over the nursing interventions, and I'm going to hit really hard on the pharmacological aspects of taking care of a diabetic patient, the education and the teaching. And I'm going to give you some clever mnemonics on how to remember that stuff, because it's a lot of stuff that you need to know for the NCLEX and your nursing lecture exams. And then I'll be having some more videos coming out about DKA, HHNS syndrome, and all those things you need to know about diabetes. So make sure you access the playlist, the endocrine playlist, so you can get access to those videos. Now, after this lecture, be sure to go to my website, RegisteredNurseRN.com, and take the free quiz. A card should be popping up to test your knowledge on diabetes. Okay, so let's get started. Okay, first, let's talk about the key players in diabetes, because if you understand what's going on normally in the body, you're going to understand why the diabetic patient is having all of these issues. So, the big key players in diabetes is glucose, insulin, glucagon, and the liver. And all of these work together to help your body use glucose, because the big issue with diabetes is an issue with insulin. And here in a second, you'll see why that's an issue. Okay, so first let's talk about glucose. What is glucose? Glucose is sugar, and your body loves sugar because your body needs it to survive. And what sugar does is it enters into the cell, or the glucose enters into the cell and fuels those cells so they can work. But the catch is that glucose cannot enter into your cell without the help of insulin. So in order, you eat all this sugar, you take it in, it enters your bloodstream, but for glucose to actually go into your cell, for your cell to use it, it has to have the help of insulin. And if you don't have any insulin at all, then you're not going to have the ability to use the glucose. And the glucose is just going to hang out in your bloodstream and cause high blood sugars, which wreaks havoc on the body. Now, glucose is mainly stored in the liver in the form of glycogen, which we'll go over in depth here in a second. Okay, insulin. What is insulin? Insulin is a hormone, and it plays a huge role in helping us bring those blood sugar levels down, because, like I said, it regulates the amount of glucose in your body. It lets glucose attach to it, and it takes it inside that cell so you can use it. And the big thing that you want to remember is that insulin is secreted by your pancreas, by the beta cells of the pancreas, in the islets of the Langerhans cells. So if this area of the body, the beta cells in the pancreas, get damaged, then you're in trouble. You're not going to have any insulin production. Now let's talk about glucagon. What is glucagon? It works in the opposite of insulin. Insulin helps us bring our sugars down. Glucagon helps us increase our blood sugar, so it helps with low blood sugar levels. And what it does is it causes the liver, because your liver will store this glucose. If you have extra glucose in the body, the liver will take it and store it and turn it into glycogen. And whenever glucagon is released, it will cause that liver to release that glycogen that it's stored up and turn it into glucose, so you can get that glucose in your body and increase your blood sugar levels. Now the liver, that's our last key player. The liver is very sensitive to insulin levels in your body. Whenever it senses that you have too high of insulin levels and you have high blood sugar levels, it starts doing its job. But if you have low insulin levels, you have low blood sugar, it also helps with that. So it's very vital in helping us keep those levels nice and normal. So whenever you have high blood sugar and a high insulin level, the liver will cause the body to absorb that extra glucose and will turn it into glycogen so you can use it later on. But then say all of a sudden your glucose drops and your insulin levels will drop as well. The liver will sense that. And this will cause the liver to release those stores of the glycogen, which will turn into glucose and increase your blood sugar. So it helps with that. Now let's recap. about the feedback loop, what happens normally in the body in someone who doesn't have diabetes. And then let's talk about what's happening in someone with diabetes. Okay, so you have high blood sugar. You ate and drank a bunch of sugary stuff. So what does your body do? The pancreas says, hey, there's a lot of blood, there's a lot of glucose in our body, so we need to use that. So the pancreas releases insulin, and the insulin causes the glucose to enter into the cells. And there may be some leftover, and the leftover will go into the liver, and the liver will store it for later and turn it into glycogen, and then use it whenever you need it. Now, say you have low blood sugar. You've been working all day as a nurse, and you haven't ate, so your blood sugar is level is low. So what will your body do? Because it wants to help protect you. The pancreas will release glucagon. Now, remember, glucagon works in the opposite of insulin, and this will cause the liver to release glycogen. Remember all those stores that stored up from all that extra glucose? And this will turn into glucose, which will increase your blood sugar. So that is what's happening in someone who doesn't have diabetes, who has a normal, healthy pancreas, and they don't have insulin issues. But what is happening to someone with diabetes? Okay, what's happening is that you're eating all your sugar, you're eating your food, but the body cannot get to that sugar, that glucose that you're eating. And this is either due to there's no insulin present, either of those beta cells in the pancreas were damaged, or the body is resistant to insulin. You're secreting insulin perfectly, but those cells are like, we don't want that, and they're not receptive to that insulin, so you can't use it. And in type 1, there's no insulin present. In type 2, the body is resistant to insulin, which we'll go over in depth here in a second. And whenever that happens, because your body's not using glucose, you get hyperglycemia, where you have an elevated blood sugar in the body, and it just hangs out. Now, when glucose hangs out in your body, this is not good. It's not meant to do that. So it starts to affect major organs of the body, and the body says, hey, we need some energy. These cells need to be able to work. Since we can't get the glucose, we've got to burn energy some other way. So it will start to burn fats, ketones, which are acids. And this happens in your type 1 diabetics. And whenever you're burning those fats and those acids, it's throwing the whole body out of whack. It's going to cause some major acid and base imbalances, which we talked about in depth in metabolic acidosis and alkalosis. Or with the type 2 diabetics, what's happening is that there is enough insulin, there's just enough where your body is not receptive to it, so it doesn't burn those fats, but instead it doesn't use the carbs. So they're having issues with carbohydrate metabolism. Now, what causes diabetes mellitus? The causes are separated into 3 different types. You have type 1, type 2, and gestational. So let's talk about type 1. Okay, type 1, remember, this is where the patient does not have any insulin. And what's happened is that those beta cells in the inlet of the Langerhans, which is in your pancreas, have been destroyed. They're not working properly at all. So there is no insulin for this patient. So in order for treatment, they have to take insulin. Now, this is not related to lifestyle like with your type 2 diabetics. This is either genetic, autoimmune. For instance, they got a virus that went in, wreaked havoc on the body, and the body attacked itself, specifically those beta cells in the pancreas, and it just doesn't work anymore. Now, how do these patients present? I would remember this. This is important. These patients are going to be thin because they're burning all that fat off because the body needs energy, so they're burning all those fats and ketones. They're going to be young. Normally this happens in children, and it's going to happen all of a sudden, and there's going to be ketones present in the urine where the body is breaking down those fats. Now, type 2 diabetics, what's happening here? The cells have quit responding to insulin. So it's insulin resistant. They don't care about the insulin. You can secrete insulin all day and they're not going to have anything to do with it. And so what happens? The glucose just hangs out in the body, but it's like a catch-22. All this insulin is being produced, it's nice and fine, but the cells just don't want anything to do with it, but you still have all this glucose, and the pancreas thinks you need more insulin because it senses that you have all this glucose still in the body. So it starts to over-secrete insulin, and you start getting the condition called hyperinsulinemia, which will lead to metabolic syndrome, so not good. And treatment for this is normally the patient, the doctor will order diet and exercise. That normally helps with that, but if that's not successful, they will start them on oral medications, which we will cover in the next video in depth. And these patients normally don't take insulin, but they may need insulin injections if they're having a lot of stress on the body, like with surgery or with infection. So that's something just to keep in mind. And this is generally type 2 diabetes is related to lifestyle, either due to being obese, having a sedentary lifestyle, a poor diet, lots of colas, things like that, and genetic. Now, how do these patients present? What do they typically look like? They're typically overweight. It happens over time. They're usually adult age, teenage age, and it's very rare for them to have ketones in the urine because remember, back to this, they don't have an issue with metabolizing the fats because there's just enough insulin, but they have issues with metabolizing those carbohydrates. Now, gestational, just wanted to throw that in. That's another type, and it's similar to your type 2 diabetes, and this is where the cells are not receptive, and it happens in pregnant women, and it will usually go away after birth. Now, let's look at the complications of diabetes and the nursing assessment. First, let's talk about complications. Okay, complications with diabetes. You can have hypoglycemia, organ problems, diabetic ketoacidosis, also called DKA, or hyperglycemic hyperosmolar non-ketotic syndrome, which we will refer to as HHNS. So let me go over these in detail. Okay, hypoglycemia. This is the opposite of hyperglycemia. Hypo means low, gly means glucose, and emia means blood. So we have low blood glucose in the blood. Usually it's around less than 60 milligrams per deciliter. Now, whenever patients have this is usually a side effect from too much insulin or too much oral diabetic medication, which we'll go over in the next video. But they're going to present as being sweaty and clammy, confused, lightheaded, dizzy, and double vision. Now, to help you remember how to treat someone with hypoglycemia, because you want to treat it fast, remember this saying, I'm sweaty, cold, and clammy, give me some candy. So these patients who are having hypoglycemia need a simple carb. Remember that. I remember a test question from nursing school, and it gave us the glucose, and it said what would be a treatment, and what the option was simple carb, complex carb, and listed all these things. But it's a simple carb of what they need. And simple carbs are like your hard candies, like Lifesavers, fruit juice, graham crackers, honey, things like that that can hit the body can absorb and take in and use. Now, if the patient's unconscious, they can't eat, normally in the hospital setting, whatever the doctor orders, you will give them IV D50. Okay, now let's look at organ problems. Okay, glucose. Think about it in our real life. Sugar. If you get sugar on your hands, it's really sticky. The same concept can apply to whenever you get way too much in the blood. What it does is it causes atherosclerotic issues where you're having hardening of the vessels. Now, what this does is this glucose enters into the blood. Glucose is naturally sticky, so it's going to start to stick to those proteins of the vessels, and they become hard and they form plaques. And normally your vessels are nice and pliable, and they're not hard. And when they're hard, they don't work properly. So let's think of all the systems in the body that are affected by hard vessels. Your heart. You can get heart disease. It's going to stick on those coronary arteries, make them hard. Blood flow is going to be narrow. There's also some plaques that can form, can cause an MI, myocardial infarction, strokes. A lot of strokes happen with that weakening of those vessels. Hypertension, again, you have stiff, hard vessels. That's going to increase resistance on your vessels, causing hypertension. Neuropathy, decreased wound healing. Again, that is because you have decreased compromised circulation from those hardening of those vessels. You can't get all those cells there to work to help heal that wound, so they will have slow wounds on their feet, especially on their feet. eye trouble, and infections. Okay, let's look at diabetic ketoacidosis, DKA. Now, in the other videos coming up in this series, we're going to go in depth about DKA treatments and all that, and we're going to actually compare it with HHNS, because people get these two conditions confused. But let me help break it down for you so you can understand it a little bit. Okay, DKA. This happens in your type 1 diabetics. It's super rare to happen in type 2. It's type 1, so keep that in mind. And another issue with this is they are burning ketones. Let the name help you out. Diabetic ketoacidosis. Okay, remember what we were talking about. Diabetes type 1, they don't have any insulin. Insulin helps glucose go into the cell for energy. So the body's like, hey, we don't have anything for energy, so we've got to start burning fats, ketones. So what happens is that the body is burning those ketones like crazy, and this is causing acids to enter into the blood whenever those ketones break down, and then you're getting some acid-base imbalances. This is life-threatening. They need to be treated. And how your patient's going to present, they're going to have extremely high blood sugars. They're going to be very thirsty, and they're going to have the causal breathing. Remember that. That's because all that acid buildup in the body, the respiratory system's trying to blow off that acid by those deep, long breaths, rapid breaths. And they can also have the acetone breath, which is like that fruity smell in their breath, and that's just because of all those ketones breaking down. Now let's look at HHNS. Okay, this happens typically in your type 2 diabetics. And part of HHS, the N stands for non-ketotic. So there is no breakdown of ketones in this, because remember, with type 2 diabetes, they have just enough insulin where they don't have to break down the fats. Instead, they have carbohydrate issues. So what you're going to have is no burning of the ketones. You're just going to have dehydration. The patient's going to be very dehydrated. They're going to be thirsty. They're going to have mental status changes, and their blood sugars are going to be crazy high, but there's going to be no ketone issues. Now, how is a patient going to present to you whenever you're assessing them? What signs and symptoms are they going to have? Okay, you'll want to remember this. These are typically test questions. Okay, the 3 Ps for hyperglycemia, because the issue with diabetes is they have high blood sugars. So the 3 Ps, which are polyuria, polydipsia, and polyphagia. Okay, what's polyuria? Polyuria is where poly means many, urea means urine, so they're having frequent urinations. They are peeing a lot. They're getting a lot of urine output. Why is this happening? Okay, this happens because of the rule of osmosis. Remember in our hypertonic, isotonic, hypotonic video, we talked about osmosis. This is where water likes to be where there's a higher concentration, so it's going to move to a higher concentration, lower concentration, higher concentration. And what's happened is there's all this glucose in your blood, and the cells, inside the cells, there's water, and the water's like, hey, all the glucose is in the blood. Let's move out of the cell and go into the bloodstream. So you have all this water shifting into the blood. That causes a lot of fluid. So what system of the body gets rid of extra fluid? The kidneys. So the kidneys start putting out all this extra fluid you have. But also, whenever the kidneys is doing that, one of the roles is that it reabsorbs glucose. But there's way too much glucose in the blood. So the kidneys can't cope with this, so they start leaking glucose. So you're going to see glycosuria. That means you're going to see glucose in their urine. Next, they're going to have polydipsia, and this plays into the polyuria. All these play off of each other. So polydipsia, poly means many, dipsia means thirst, drinking. So they're going to be very thirsty, and this is because of the polyuria, because they're putting out all this fluid. The body's like, hey, we got to keep drinking to keep hydrating ourselves because we're putting out all this water. And then the polyphagia, that means they're very hungry. They're just constantly craving food. And this ties back to burning all those fats, all those ketones. The body needs the energy because it can't get to the glucose. So the body's like, hey, we've got to eat. Keep eating food so we can keep burning this energy. And these 3 Ps are mainly seen in your type 1 diabetics. Okay, now, let's look at another mnemonic. Remember the word sugar. This is what you're going to see in both the type 1 and the type 2. Okay, S for slow wound healing. Again, that's because of that glucose being sticky, hardening those vessels, so you have decreased perfusion to help heal those wounds. The U, blurry, blurry vision. Again, that's because the damage to the eyes with all that glucose. Glycosuria, that's where the kidneys can't cope with all that extra glucose, so it leaks into the urine. A for acetone breath, that is mainly seen in your type 1s, and that's because of the burning of the ketones. It gives off that fruity smell of the breath. R for rashes on the skin and repeated yeast infections in women, because yeast love glucose. So if you have too much glucose, yeast is going to build up and they have repeated vaginal infections of yeast. Okay, so that is about diabetes mellitus. Now, don't forget to take that free quiz. You should get the card, or it's down in the description below. And be sure to check out that other video where I'm going over the nursing interventions, where I'm covering the pharmacological aspects of treatment of diabetes. And thank you so much for watching, and please consider subscribing to this YouTube channel.